Good morning. How are you doing today?
I am feeling energetic and great today. Thank you.
Good to hear that. You're welcome to our platform today for mental health awareness, which I have started since almost 2-3 days right now. It's part of my research work and privilege and opportunity to promote awareness in our society as a whole. So you are coming up today for two purposes, to support our research and at the same time to be a blessing to many people that will be hearing this. Just to ask from you today, your view about mental health issue. Many people said it is not real. Many people said people with mental health issue are possessed of demons or evil spirits. People have said mental health, so many things are going on outside there. But for you, what is your opinion about this? Is it real?
As somebody who has struggled with mental health challenges, as I would say, over a large part of my life, I would have to say that mental health is very real.
Mm-hmm.
If I am experiencing something and it seems real to me, that is my reality. So I feel like you can't really take that experience away from myself or others who are facing challenges with what is going on mentally inside of them. So saying that it is real, I really feel that your mental health is really dependent on your level of awareness. And I have struggled with addiction for 22 years. And for, 22 years, I wasn't aware of anything really at all. So I feel like it's really dependent on your level of awareness. And if I didn't have awareness, I feel like that led to a lot of diagnosis for myself as well. For me.
Yeah, thank you for sharing that. I just want to pick up something there before, we let it slip off our finger. That is what I've gotten from what you say now is that mental health issues and problems, challenges are real. So, but in our society today, many don't believe. People, make jest of many people, other people who are going through this. Many people desert them. They don't talk to them again and all that. What's your view about this?
Well, I can understand why people would reject that idea. I think a lot of them come from a place of fear. We don't want to question the stories that we believe to be real. We don't want to question elements of ourselves, which we believe to be true. So there's like a lack of critical thinking, I feel, based on fear. And also a lack of education. If people aren't made aware and educated about the role that our mentality plays in our health, you're almost like driving a boat and you're not really understanding the mechanics of it. So I guess that's what I would say.
Yeah, thank you for sharing that. You don't think mental health issue has nothing to do with where you come from, your background, your family? Does it have respect for anything like that?
I definitely feel like there's environmental factors that have an impact on our mental health. It's so complex. It's so complex to me, again, I feel like it's the fear that, we have, and that's what limits us. It limits our beliefs, it limits our opinions, it limits our reality. And when you can remove fear and you can educate the public and increase their awareness, I really feel like people can live more in possibility than in limitation with their
Absolutely.
mental health.
Sure, sure. From part of my, what I came across recently, in some journals, some articles, some researches and all that, that the youth, especially people from the age of 15 and probably 35 or 40, are badly affected, when it comes to mental health. What's your view about that? Do you believe with that also? That's young people are the victim most of the time.
I can. And without me like calling out anything specific, I will say that I feel like our education system leaves an imprint on children, especially when you're more vulnerable, to shaping the person that you identify as and who you can become. I feel like there's a real lack of people really knowing who they are, because a lot of times when somebody asks us, who are you, we complete that sentence with a lot of words, and the reality is we are more than any word we can come up with to create a sentence and make that statement. And there's just a lot of external factors that are impacting young adults, leaving them in an identity crisis, not knowing who they are, getting so confused within our minds that we create this chaos because we are just lost and disconnected from our true selves.
But this must be one of the reasons why they are more depressed and anxious, because from the research we got to know that the youth, especially the teenagers, young adults, are badly affected with depression these days.
Yeah,
because that has connection with that.
Yeah, and I think it's because they're more vulnerable, especially when family members are also not educated and aware of mental health. You're kind of pushed aside and just told to act normal and believe what you're told and don't question anything. But in reality, I don't know. I feel like we're getting lost in that, and it's concerning, definitely.
I just want to ask you, in your experience, do you think you have ever experienced any stigma around you, the family, among your friends? What's your view about that?
I think that stigma is definitely something that limits our evolution, especially for myself as somebody who's struggled with addiction. The stigma prevented me from admitting I had a problem, because that meant a whole bunch of other things for me, just admitting that I had a problem. Stigma also affected me from, it limited my ability to get help. I was scared to, take that step as well. I guess overall, I would say that stigma becomes the narrative that I tell myself in my own mind, and it's something that limits my evolution as a human being.
I hear you. Thank you for bringing in this space. And finally, on this note today, what is your advice for our community, our society, and families, most especially, after this pandemic, this post-COVID-19, life?
Well, I think that it's time to really, pull our bootstraps up and take action with the data that we have, has been studied and researched, and what the conclusions are that have been drawn from it. I think that now is, the best time really to increase the awareness within our communities, increase education, within our families, and really just put a focus on helping people learn to help themselves and really thrive.
Perfect. Now is the time to increase the awareness. And on that note, I would like to stop today. Thank you so much for giving us this time, sparing this time to be here with us, to share with us on this awareness piece. I really appreciate that. It means so much to me. Thank you. Take care.
Thank you.
Bye.
Bye.